My name is Tom Clark. I'm the owner of Tom Clark Solutions. Welcome to In the Lobby, where we are going to talk about what's happening at the state legislature this legislative session. So we've gone a month. We've been in the legislative process for a month. It's been interesting. It's been daunting. It's been frustrating at times. If I can give any vote of confidence, I think that policy is still being made. Decisions are still being made. We are able to participate in the process, whether it be testifying in committee or having conversations with legislators via Zoom or by phone. It's a little bit more difficult because we don't have the ability to capture them in the hall as they walk between committee and their office, or from their office to the restroom, or in the stairwells and the different places that we're used to being able to capture legislators and make our pitch to advocate for or against particular pieces of legislation. So we will continue the grind. Tom Clark Solutions has our offices in Carson City. We're there 3 or 4 days a week with the hopes that we can advocate and represent our clients and on the myriad of issues that we have to that we're dealing with this legislative session. So let's talk about the big issues that we're really facing this legislative session. Healthcare. We do a lot of work in the healthcare realm because we represent the health insurance companies here in the state. We also represent rural medical and rural ambulatory services and a number of different other areas within the healthcare industry. Telehealth is a really big issue this legislative session, whether it be teledentistry, mental health services that people can receive on the phone or by video with their mental health provider, and of course telemedicine so that patients can not have to go to the urgent care or to the emergency room. If they're not feeling good, they can pick up the phone, they can then talk to their physician via video camera, video Zoom, other ways. How are those services billed compared to what's actually happening inside of a doctor's office? So are we going to bill the same rate? Will the provider bill the same rate for that office visit that they bill for just getting you on the phone and letting you know if you need to go to the doctor? So telehealth is definitely a big issue this legislative session, and data collection. A lot of legislators really want to have a better idea of the cost of healthcare, how patients are being provided those services, and collecting that data from both the health insurance side, the hospital side, the provider side. That's all really important stuff from a policy perspective that the legislature is trying to accomplish in this first month of the legislative session. Now, also on healthcare, we're going to see a lot more pieces of legislation coming down the road that deal with specific policies as they relate to mental health and, of course, the cost of health insurance going forward. Another really big issue that we're dealing with, mining. During the special legislative session, there were 3 resolutions passed that would put to a vote of the people how they could change the tax policy around the minerals that we mine here in Nevada, whether that be lithium, gold, copper, silver, magnesium, all of those different things. There's a movement up front that says that mining doesn't pay its fair share in taxes. And so we'll see a rehash of those resolutions this legislative session, and then we'll also see potentially other mechanisms by which the legislature can make changes to tax policy as it relates to mining. It's still early in the legislative session for those types of issues, but we're definitely going to start seeing those in the second and third month of this legislative session. So we've gone through the first month of the legislative session. So what's next? Okay, so the next thing that we're going to see is a deadline. It's an unfortunate deadline in that it falls on the Ides of March. And by the 15th of March, if you're an individual legislator, what you have as a bill draft request has to be introduced on the floor in the respective house. So if you're Assemblywoman X and you've got a bill draft request, and that bill draft request is with the Legislative Council Bureau being drafted as a bill, it needs to be formally introduced in first reading by the Ides of March. So there's going to be a lot of long hours going into the next couple of weeks, long floor sessions as they attempt to introduce as much of that legislation as they can by that March 15th deadline.